Hello everyone, good evening. This is Dr. Praveen Ramachandra. I will be the moderator for this session. The topic for today's webinar is do's and don'ts for doctors in COVID-19 pandemic.
Okay. Good evening. I am Dr. Chalpathy, gastroenterologist at Visakhapatnam. First of all, thank you all for joining here in this difficult times. I hope all of you are safe. Am I audible and visible? My slides are visible?
Yes, your
Hello?
slides are visible. Yeah, is
Right.
visible.
Am I audible?
Yeah.
Okay. Right. So, Dr. Khalik has given an overview of what we are going to do outside our hospital to protect ourselves and our family also. But since we are almost coming to the end of our lockdown and some relaxation period, we have to increase our visits to hospital and start our OPDs or procedures or do inpatient visits in due course. So I'm going to discuss about certain points, what we should do and we should not do while we are doing our rounds or daily patient care in hospital. So this may not be a great science, but it comes out of our common practice of infection control during these difficult times. So we should know what we should do and we should not do, but also we should also let others and including our staff involving in paramedical staff or admin staff like that, what they should do and they should not do. And in my second part of the topic, I'll be taking care of changes to be made in the clinic or in the hospital to suit the current COVID pandemic. So this is the hierarchy of controls that is established by the National Institute of Occupational Safety and Hazards. So this is the hierarchy that is starts from PPE to protect the personal protective equipment. There can be administrative control changes where there will be a change in the way that people will work. There can be changes in the engineering controls, that is to isolate the people from the hazard, that is COVID. There can be substitution. You can replace the hazard if somebody is infected. Some normal person can be replaced, and if there is any change in the protocol, we can replace so that we can combat the hazard. And ultimately, we can eliminate the hazard, physically remove the hazard, like take off the person from the hospital, shift to the other hospital where a better care is needed, like that. So this is the hierarchy of controls, and we follow from least effective to most effective. We should not forget all these things when we enter into the hospital: an N95 mask, scrubs, and we should completely protect ourselves. No skin area should be exposed when we are taking care of the patients, and we should be constantly following the hand sanitizer disinfection policy. And why I actually put up a second pair of gloves is when we are actually examining the patient, it is always advisable to change a second pair of gloves of a different color so that we'll be remembering this protocol. So that each and every patient, after each and every patient examination, we can remove the outer gloves. If it is colored in a different coat like a blue or brown, we'll remember that. So before start of the day, it is always ideal when you step out of the car, at the security entrance itself, get your fever checked, and that gives us an example to others. So that if a doctor is getting checked at the security, then the rest of the patients and other staff members also get checked at the security entrance. And if there are any signs of fever like that, then obviously it needs to be addressed before start of the work. This will also remove a stigma that is prevailing among your staff for testing. And leave all your belongings in the car as already told, and remember to hand sanitize regularly with alcohol based hand rubs. So before start of the day, if you have not already changed at home, so change to scrub suits provided in the hospital, or if you have a personal equipment, and immediately and use these clothes throughout the day in the hospital, and change to hospital shoes as well. It is preferable to wear an overall or apron over the scrub suits for additional protection. It is always preferable to have an inner pair of gloves, and remember to hand sanitize even the inner pair of gloves regularly. and keep minimum staffing to avoid more number getting exposed to the patients. And it is always important to identify the staff who are older than 60, who are immunocompromised, who have some comorbid conditions like diabetes or hypertension, and you can shift them to non-COVID areas or assign them some job of telehealth to limit the exposure to the direct patient care. So you can check your staff before start of the OPD. You can check your staff, talk to them, and if they have any suspicious symptoms for themselves in their home or in the neighborhood, just inquire. And if there is any suspicious feature like that, then deal with it. And be polite with them rather than shouting at them, why have you come to the hospital, like that. So because they also need the care, and encourage them to practice the same way what you're doing. Doctors may not be the perfect, but we have to go to near perfection, and it is the simplest way to tell them, practice whatever I am doing, and educate them regularly about the care to protect themselves from getting the risk of getting infected from the OPD patients, and educate them how to identify the patients suffering from COVID-19 disease, like symptoms like fever, sore throat, myalgias, cough, etc. And it is always a good idea to ask them to fill up patient symptom questionnaires forms, checklist forms, and disclosure statements at the front desk itself when they are waiting at the waiting area. And any patient having any of these positive symptoms or suspicious of COVID-19, they can be identified and they should be sent to the emergency at the nearest COVID-19 hospital. And always deal with your staff in a polite way. The staff may be very much anxious and depressed in these difficult times. So please take the responsibility to boost up their morale and educate them with proper techniques of usage of PPE and handle the situation very smoothly, like donning and doffing, etc. You need to continuously educate them. So these are certain precautions we keep following regularly. And most importantly, don't shake your hands with anybody. That is most important. Whenever you see your colleague or your staff member or any close patient or any known to patient, so please avoid hand-to-hand shake. So it is always a good idea to maintain a separate OPD for suspected patients just at entering before the hospital itself. So if anybody is having a suspicious symptom, then they will be screened there itself. And run some COVID-19 related education videos in the television available in the OPD waiting areas near your chamber, so that people will actually get what are the facts. And in fact, if possible, you directly talk, make a video and post it on the television so that they can have a confidence. So these are some of the disclosure and questionnaire forms that we follow at our hospital in Vizag, where patient will be following this, and they will be signing it up. And the questionnaire will includes travel history, any contact, if there is any fever, sore throat, dry cough, etc. And sometimes with the risk of nosocomial COVID infection, sometimes a normal patient can also get infected unknowingly, and they may create medical legal problems to the hospital and the clinic. So it is always better to encourage them to have been wearing a face mask and carry a hand sanitizer, but still they can contract a nosocomial infection. So it is always better to let them sign this informed consent so that you will be protected. So before start of the day, ensure that all your belongings, including a pen, wallet, phone, watch, kitchen keys, keys, chains, rings, ornaments, and belts are not carried with you. Either they can be kept in the car or safe locker, preferably in the car itself. All the patients and relatives present should be wearing a mask, and educate them to use hand sanitizer regularly. So these are the certain things. The first two things, you can use a Bluetooth. You can carry two sets of Bluetooth, one at home and another in the hospital, and you need not exchange it so that the risk of carrying infection is less. You can use a Ziploc cover to cover your cell phone, and you can handle the cell phone through the cover itself, but preferably it is better if you handle it through a Bluetooth or hands-free mode, or you can give it to a non-medical assistant so that they can handle any calls for you. And remember, all these patient care equipment like stethoscope, thermometer, pulse oximeter, or patient weight scale, and sphygmomanometer, all these things should be disinfected regularly after each patient use. It is very, very important. And when you're in the chamber while examining, use a second pair of gloves of a different color to touch the patient and wipe out the stethoscope and other patient examination between each patient. Change the outer gloves between each patient. It is very important. And wipe off the pen, table, chairs, examination couch, computer, keyboard, computer monitor, doorknobs, etc. with alcohol wipes after entry and exit of patients and relatives. So it is very important. You can take alcohol. There are some disinfectant wipes available, or you can use the regular alcohol scrub to spray and then wipe it off with the tissue. And similarly, most importantly, the elevator knobs also need to be disinfected. All the formats need to be disinfected because they still carry the risk of uh, transmitting the infection. As much as possible, avoid touching the face when you are showing your emotions with the patient. If you are showing some empathy towards patient, sometimes we use these kind of gestures by touching the face, nose, and eyes. And don't do that even with the gloved hands. Avoid close contact with the patient while examining or talking to the patient relatives. OPD can be conducted in halls rather than rooms. Certain of my colleagues, they do practice that, but this might cause a breach of identity and may not be accepted by many patients, especially female patients and elderly patients. And but the advantage is if we do such kind of OPDs in halls, that might avoid handling of doors and handles. But an alternative is you can use curtains to protect the patient privacy even in open halls, and you can still continue running the OPDs. And remember to disinfect these curtains as well. The other precautions is use fresh paper for each prescription each time. Don't turn around the paper and use the same paper, because it might be carrying some infection. And after the OPD, advise the patients and relatives to use alcohol sanitizer and not to touch anything with their hands, especially the staircase handles, lift doors, and lift control buttons. If at all they need to handle it with gloves or using some tissue paper like that. And ensure the same precautions and steps are followed at the pharmacy and lab also. It is very important. And at the front office, lab, pharmacy, a transparent acrylic screen can be placed to use a barrier as a barrier between the hospital staff and patient relatives. So I'll be dealing some of these things in my next part of the lecture. And most importantly, never forget washrooms that are present in the patient waiting halls. Ensure only one person utilizes the washroom at any time. Ensure proper flush of the excreta and cleaning of the excreta and urine on the floor, pan, lead, and other places. And please educate them to close the lid first and then flush it, so that there will not be any aerosol spread. Encourage use of soap and water to clean the hands after use, and ensure the proper disinfection of these rooms with sodium hypochlorite after each usage, including the doorknobs, pistons, and taps. Encourage to air dry or use toilet tissue to clean the hands and properly dispose it off in the appropriate bin. And finally, whenever possible, encourage telemedicine consultation for non-urgent patients, especially follow-up patients who want to refill their prescriptions. This would reduce the crowding and physical contact, but understand the telemedicine guidelines first before following that. And if there is any doubt, please do not hesitate to call the patient for physical examination with full protection, because patient safety is of prime importance. Few words about inpatient care. So many physicians they deal with COVID patients, including the ICU staff, the emergency doctors, but a few of the gastroenterologists also, they do get calls because certain patients, they have GI symptoms. It is always important to identify and maintain the COVID and non-COVID zones first in the hospital, including ICU. Maintain the same precautions for infection control, but follow it more stringently, as there will be more sicker patients. Shift to full gear personal protective equipment for all IP care, and minimize the number of, most importantly, minimize the number of physical visits. Like if you have a habit of seeing your patients twice or thrice per day, minimize it. And also minimize the staff while you're on rounds, especially physician assistants, interviewers, patient counselors, etc. And also avoid duplicate staffs. If you can assign multitasking to the minimum size of staff. Utilize the patient examination, patient care equipment in a dedicated way for each patient without exchange. Very important. There is a habit of using the same BP machine to multiple patients, stethoscope to multiple patients, which can transmit the infection. and encourage the staff to keep, if there is a ventilator or a defibrillator, rather than assigning to each and every patient, it is always better to take off these life-saving equipment to a common area and keep a lock of it, and if there is any need, then transfer this equipment to the patient care area. Otherwise, if they are lying free in the patient care area, they can carry some infection. So it is always better to isolate them from the patient care area, but keep it in the nearby area, and avoid visitors, patient roaming outside for an evening walk like that, and avoid mixing up with non-COVID patients. And it's very important to educate the security staff, nursing staff, housing staff, housekeeping staff, and administrative staff about the infection control practices. What about cross consultations? For example, if the COVID patient or some other patient is admitted with some other primary care physician, you will be called for that there is a diarrhea, there is jaundice, there is hepatitis. So gastroenterologist will be called, and before doing that, please remember that up to 11 to 15% of patients can have GI symptoms, including diarrhea, nausea, and vomiting. Up to 75% of patients can have liver enzyme abnormalities, as reported in various series, and up to 10% of patients can have jaundice. Especially these abnormalities and GI symptoms can be more severe, especially liver injury in more sick and severe patients. So be careful, especially in ICUs. Try to avoid multiple doctor consultations. This is very important because the primary care consultant will call you, come and see the patient. It's better to avoid multiple doctors having a physical consultation for a single patient. You can just consult the patient from outside. So what my advice is, one primary doctor can see the patient and others can review his records outside the patient area and be available for phone consultation. That is important, and that is enough also in these difficult times. So if there is any emergency procedure is needed, always follow the standard precautions, and part of it will be discussed in my next talk. So most importantly, protect yourself, but your staff also should be taken along with you as well. Thank you.
Thank you, Dr. Chalapati.